Good morning, everyone, and thank you as always for the opportunity to speak with you all. And I will say thank you to Earl, who often joins me in these calls and has to sit and listen to me talk and then provide his update. I'm open to switching the order sometimes, so you just let me know so that we can get the information out. I hope you all are having a good Thursday. I want to give some highlights, and then I anticipate that there will be a number of questions and conversation. So, a couple of updates. Big ticket item that was released this week is the dashboard that provides data for the metrics that we talked about last week in terms of guiding the process of beginning to reopen. Now, a couple of things to highlight is that we continue to work very closely with our colleagues across the state of Maryland, as well as the National Capital Region, including DC and Northern Virginia, to look at these metrics and to see where we are. In fact, we've had daily calls or conversations with Dr. Nesbitt in DC and almost daily calls with our colleagues in Prince George's County, talking through where they are. And we remain united in terms of looking at the approaches, how we move forward. So as it relates to our data dashboard, again, I know that there was significant input from council in terms of how to tweak it and improve it in terms of how it's displayed. We are showing positive movement. Looking at the 3-day averages, I think it's showing a number of the measures have actually had double-digit stays in terms of the last 14 days, where we've seen positive movement. And there are a number of other areas. For example, the number of new cases on a daily basis are trending in the right direction. Now, certainly there was an aberration, or we hope it was an aberration, 2 days ago when there were reported 533 new cases. That changed yesterday to 102, and I confess I don't have the aggregate numbers this morning in front of me, but the previous days suggested that we were trending downward in that area. Now, across the board, we do see positive movements, but again, not every movement, every measure is 100% in terms of where we want to be. For example, continue to have concerns about ICU capacity. As we talked before, I think on our Monday call, a number of the hospitals have actually, earlier this week, 4 of the 6 hospitals were at full capacity for their original configurations for ICU beds. To this morning, 2 of them are at capacity. The others, more beds are becoming available. In addition to that, from an acute bed perspective, only one of the hospitals has utilized some of their emergency room space to board patients. So those numbers are moving in the right direction, but still a ways to go. Now, to that end, we had some conversations. We had a call with the state on Tuesday to discuss surge capacity. And part of that strategy was looking at how we could potentially repurpose spaces at the Tacoma Park campus of Washington Adventist to provide additional ICU bed capacity, which would increase the denominator and bring that percentage and bring the percentage of ICU beds in use down, and give us the opportunity to grow should we need those spaces in the future. So I say all that to say the numbers are trending in the right direction. Let me be very clear. That does not mean we are making any pronouncements on a particular day to say, May 26th, May 29th, June 4th is when we would reopen. Merely just suggesting that the data is moving in a direction so that we can entertain some of those conversations and discuss how to safely move forward and what that looks like. Let me just again emphasize that from a health perspective, we've not made any of those declarations, and we'll continue to provide input and insight to the county executive and county council as to how we best move forward for us as a county and also consistent with our partners in the region. Now, a couple of the other indicators that are essential to that are more of the qualitative components include testing capacity. We continue to make strides in that area. And our high throughput option will be able to bring on 10,000 tests a week for the next 2 weeks and upwards of 20,000 tests a week just simply from that modality. In addition to that, the state has made allocations where they are providing, we haven't received them yet, but we were told that they're coming, weekly allocations of additional nasopharyngeal swab capacity that the state will support. And we hope to utilize that to bolster our alternative test sites as well as our mobile testing arm once that is stood up at the beginning of next week. It's our goal. And we also have been working with a number of community partners to explore creating pop-up testing in high volume areas throughout the county. Additionally, the governor has made some announcements about requiring testing in a number of settings. We continue to wait for specifics on that. As it relates to testing in nursing homes, I think we talked about it on Monday, but we, as of this morning, 25 of our 33 nursing homes have scheduled visits that have either been completed or on the books to be completed by the National Guard team from the state. And we are working with them to figure out how we can augment, supplement, and get those remaining 8 nursing homes tested as soon as possible within that time frame. Our understanding is that we hope, at least from the health officer perspective, is that there will be consideration to expand that universal testing from the state perspective to assisted living facilities and other long-term care facilities. And certainly in the absence of that, or even supplementing that effort, we are looking into how we can support that and provide testing in those facilities and spaces over the next week or so. Again, want to emphasize that when we're looking at the high throughput testing option, as we've talked about before, our goal is to begin opening up opportunities for asymptomatic individuals. That will be phased in as we increase capacity from that perspective, focusing on our essential employees. The first wave will be our first line responders, working very closely with our partners in law enforcement, corrections, police, and fire and rescue. And then the second wave will be also looking at other essential employees across other different agencies within the county, as well as providing testing opportunities for our healthcare workers. And then as that expands, increasing opportunities and access for other first line responders, essential employees, and ultimately, hopefully in the near future, the general public to be able to access those resources. Another essential component to moving forward is the presence and sustainability of contact tracing. As I've mentioned before too, we are working with the state. So we continue to do contact tracing here, but the state is leading an effort to coordinate with all of the health departments across the state, utilizing their platform. That platform will go live next week. All of our staff who are working through that will be trained on Tuesday. And then we'll be able to utilize the electronic platform for the state that includes information from the CRISP database, as well as a shared platform where we're able to access across different jurisdictions. So that will be in place next week, and that will address our metric in terms of being able to ensure contact tracing within the first 24 hours of all new cases. And again, the model that is being used is the state is hiring over 1,000 individuals, and they will perform the contact tracing, the initial contact tracing on a daily basis for the cases as they come in from the CRISP database and the NEDS database. And then the local health departments within their their respective protocols will supplement that and continue that contact tracing process. A couple of other components I want to highlight. We are doing some educational outreach opportunities. Healthy Montgomery is going to sponsor a host of community conversations and webinars. The first one is scheduled for May 29th, next Friday, from 3 to 4 o'clock. Dr. Liu, who is our chief epidemiologist, and myself will give a conversation in terms of the nuts and bolts of a public health response. And the team continues to partner with our healthcare systems to identify other speakers to participate in that conversation. Other component, we have met with our Montgomery Cares and Safety Net clinics this week to talk about assessment in terms of how to provide services within the realm of our safety net network as we move forward from COVID and as we continue to work through COVID, including testing, but also making sure that people are continuing to get access to address their other health issues. I did have one last thing I want to mention is I did have a great conversation with the Medical Society last week, and last night we've created a series of conversations that are going to be bi-weekly to talk with the healthcare providers across the county about their emergent needs. Two of the projects that we're going to partner on and work together to get information out on is the effort to encourage parents to get their kids immunized. and recognizing that health systems are safe to be able to do that, provide that service, and continuing to encourage residents of the county to, if they have health issues, to not be afraid to access the health system to get the health care that they need. I will stop there, and as always, happy to answer any questions you all have.
Thank you very much. Dr. Stoddard, we have several council members who want to ask questions, but how long is your presentation going to be? Do you want to make your presentation and then ask questions? Because I'm sure they'll also want to ask questions of you.
I'll certainly defer to your judgment. I would say mine.
Couldn't hear you. How long?
5 to 7 minutes.
I think we can last 5 to 7 minutes. Go ahead, please. Yeah.
Okay. Okay, great. So talking about several areas here, personal protective equipment being first. We are doing distributions to essential child care providers this week of both PPE and cleaning supplies, infrared thermometers. We did a round of this last week. It'll continue at the Dennis Avenue Health Center tomorrow and Saturday, and at the Public Safety Headquarters in Gaithersburg on Saturday as well. So those child care providers can come and pick up those supplies there. We're also doing a direct distribution to our primary care providers. We're doing a couple things in that arena. So we've actually stood up a local business has stood up essentially a wholesale opportunity PPE acquisition for small scale purchase of PPE. That's available through mocoppe.com. But for the cases of supplies that are not available through that source, we're actually still doing distribution to our primary care providers, dental offices, and the like. And they can access that through the county's website. There's a request form there right on our COVID page under the community resources. We continue distributions as well to our DD providers, our ID providers, and our nursing homes and long-term care facilities. They are receiving the bulk of the resources that we send out, and we'll continue to do so throughout this event. We are also continuing to build the stockpile of PPE for, giving us a buffer for reopening, as Dr. Gales alluded to, giving us a buffer should something return to us in the fall. Obviously, we want to make sure that we're not in the same situation we were in 2 months ago in terms of PPE ever again. So that effort continues. I do want to highlight some of the 311 activity. I know this has been something we've talked about several times before, but the report from yesterday was noteworthy. We had 833 total COVID-related calls to the 311 call center yesterday. Of those 833, 571 were related to the EARP program, the Emergency Assistance Relief Payment Program, and 90% of those 571 calls were in Spanish, which is the high water mark for the percentage of Spanish speakers who are calling in on that program. 102 calls were related to the Rental Assistance Program in HHS, and 74% of those 102 calls were to the Spanish language queue. So that means that 71% of our total COVID calls were related to those two programs yesterday. And in total, 311, 32% of the calls coming into 311 yesterday were in Spanish, which is it's more than 6 to 7 times higher than they see on an average day. And so obviously the interest from our community is significant, particularly from our Latino community. And obviously they're ramping up additional call takers to take those. I know there have been some queues of up to several minutes long. These calls are also taking longer, and largely because the people calling into the Spanish language queue have more needs in terms of they ask for more services. And so that is not unexpected. I think for anyone who's been working with our various communities for a long time. But obviously this just, continues to pose challenges and things that have to be addressed. And, Barry Hudson and Brian Roberts from 311 are actively working to expand the number of Spanish language call takers into the 311 call center to address that problem. The Food Security Task Force, a couple updates here. Working with the Health and Human Services Street Outreach Team to connect them directly to food delivery. And so when they're engaging with the public out on the street offering them services, they're going to also offer them food support services. They're tying in a sort of apparatus between our ethnic grocery stores, our Department of General Services providing transportation support for the goods, and the street outreach team doing the identification of need and distribution. We also are working on this farm to table program that the USDA has launched. I think we're getting 3,000 USDA boxes and distributing them every week. Those are great because obviously not only are they food, but they are high nutrition value, fruits and vegetables, and other things that can help address some of the food inequities in terms of and not as many empty calories. A ton of additional work in the Food Security Task Force, and I know a lot of that will. I know that there's been some suggestions that council might want to receive its own briefing from the Food Security Task Force. I think that would be entirely appropriate, and that's something I'd absolutely recommend you do. Couple other items. So we have signed contracts with hotels in Germantown. We already had one with Silver Spring and Gaithersburg as well to do quarantining of persons. We're still finalizing logistics of how the entry point for that will work. It will likely be the disease control call line at Dennis Avenue, but obviously we want to make sure that they're ready to receive those kinds of calls. They are already being used. The rooms are already being utilized by the ready responder teams that Dr. Gales has talked about before, where they identify persons who may need to be quarantined or isolated that can't do so successfully at home. We expect that with contact tracing ramping up through increased testing, through these mass testing options that we're about to launch, we expect that we will identify more people who need this service and have contracts in place to allow us to address that need. Then the final 2 points I'll make is that we are standing up our recovery framework. I know that a draft of that has been shared with council. We'll be getting additional feedback from you all about how you can be engaged in the process. We take very seriously the partnership between the executive branch and the county council on the recovery. And I think it's very important. I want to say this. I'm going to say this in every opportunity I can. We know that recovery means more than just reopening. Reopening is but the beginning of recovery. There are many long-term issues. Just because we can get a business reopened, for example, does not necessarily mean that business is fine. They're going to survive, no problem. They're going to have. We have a rent moratorium right now in a lot of places, and obviously, once that's not a forever thing. And so we've got to figure out exactly how we move forward beyond just the initial reopening phase and how we can build in long-term community supports and just address things like health inequities, health literacy issues, community wealth, and all those things moving forward. And the final thing I will update is a fairly good piece of news, and one we may have additional on this, but I'll say what we know so far. So FEMA, we are working on FEMA reimbursement for some of the activities that we have undertaken already, and I would expect that some of those costs are going to go up this week and be requested of. It's important to note that FEMA reimbursement is normally a 75-25 local, 75% federal support, 25% local support. They're going to allow us to use the Coronavirus Relief Fund as that 25% match, which obviously gives us additional flexibility in how we utilize our resources. There is some hope that ultimately FEMA will do 100% reimbursement and not even require that we use the Coronavirus Relief Fund. That's something that's part of some of the congressional packages that are now sitting in the Senate. So we'll see what makes it through and what does not. But we at least have the good piece of news that we can use the CRF funding as the match for the FEMA reimbursements so far. And I will stop there.
Thank you very much. Councilmember Rice. And just so everybody's aware, we discussed earlier, remind everybody that we're going to do the 5-minute rule, but after everybody else has spoken, if somebody hadn't gotten their answers, then we'll do another 5 minutes for that person as well. Okay, Councilmember Rice.
Well, thank you very much, Mr. President. I'll try and be very brief. Dr. Gales and Dr. Stoddard, I guess this question is for the both of you. So thank you, Mr. President, in terms of teeing up both of them. When it comes to recovery efforts, we've heard from a number of business owners that are very concerned about proper practices and procedures that they need to enact to ensure their safety as well as the safety of their patrons. And so from that perspective, has there been, as a part of this initial recovery effort, guidance given to folks, especially language appropriate in a lot of cases, about it's great to hand someone a temporal thermometer, but do they know how to use it properly? Do they know how to keep social distancing while doing it? All those kinds of things. Are those mechanisms in place in terms of instruction? And then even when it comes to the purchase of additional equipment, i.e. air purifiers, things like that, installing screens where appropriate, plexiglass screens and the like. Is there any guidance being given to folks about what truly are the best practices to, again, ensure the safety of their employees and their patrons, and putting all of that together in terms of webinars or leaflets that you can give out to individual business owners?
Sure. Well, I'll take a first crack at it. I'll say I think that is essential to any strategies talking about reopening, and I think as part of, as we potentially move in that direction, I think that has to be a part of the conversation. So, for example, if we're telling a business, and this again, not committing to any of this right now for those folks that are watching at home, but say if you say you're going to, their provisions would be made for you to open up, but we would expect you to have capacity limits and, consistent with what we did with grocery stores. I think there would need to be, as part of that, some time to give businesses the opportunity to get those provisions in place. And, obviously have enough warning to say, this is potentially coming. I do know that, and I think these conversations will continue to move forward, again, with council involvement, that will be an essential part of that. It must be a part, because we don't want to have an issue where we're letting businesses open up potentially, and having to go back and tell people, you're not doing this properly, or fining businesses, because I think the majority of folks would like to reopen, but they would like to reopen safely.
I would only add, and I don't want to take too much of your time, that we're already working on guidance for pools, for child care providers, for certainly the first round of retail. I think I would only just say that there is a lot of guidance that's already out there. We're just trying to pull together. We're not reinventing the wheel. We're trying to pull together what's already out there in an easily digestible manner. But we're just, there's a lot of guidance that's being requested. We're trying to triage it based on who needs the guidance soonest, because they'll be opening up soonest based on how we project the phases to work out. And I think we're going to continue to produce more guidance and update guidance as we go along.
Well, I really appreciate that. And I think that overall, when it comes to what that guidance will look like, again, we just need to make sure that we have language appropriate. We ran into those problems and continue to have those challenges with 311. We ran into those problems with a lot of our businesses trying to get the initial access to funds. So we know that presents a challenge to us. But then also from a purchasing standpoint, it's great that we're providing some of the temporal thermometers and others, but there will be some investment that businesses who are already cash strapped will have to do to be able to meet these guidelines. And so the more information we can give them ahead of time to help them pre-plan and to purchase this stuff, even spread out to how they're going to purchase it, is going to be incredibly important as well. Because, that's one of my concerns is that, okay, we pick a date and we say, okay, now things are open. And the reality is they haven't had time to prepare to set up those kinds of things and still lag well behind, or feel the pressure to go ahead and open even though they don't have all of those things. So I would just ask that. I think that we're saying the same thing and on the same page, but as much information as we can give folks ahead of time, the better. Thank you.
100% agree, 100%.
Thank you. I do think on that note, though, it should be something that when you're saying to a business that you need to get this type of supplies, it should be flexible enough that if those supplies are not available, they should be able to get some kind of a supply that could be substituted for it. So, we don't want to catch 22 here. We want to be as flexible as we can. Councilmember Navarro, please.
Thank you, Mr. President. And again, thank you, Dr. Stoddard and Dr. Gales. So one of the things that I did bring up to Mr. Andrew Klein today was this notion of some of the articles that have come out regarding opening perhaps in the next 2 weeks and making sure, as you can imagine, the interest that exists and the questions that we're receiving. So it would be really important for the council to receive that kind of possible information before we read it in particular newspapers or hear the executive speak about that, for example, on the MCM interview. Everybody's so eager, and I know that we have all been super responsible in terms of following the data and trying to make sure that these trends actually hold. But obviously, whenever the executive then makes the comment like, I believe that we're going to be able to open in the next 1 or 2 weeks, that sort of sets this frenzy. So I wanted to say that and just request that please let us also get that information and also your perspective as to why you believe that that might be a possibility. We've been very disciplined in not putting out a timeline, so those kinds of comments and articles really work against what we're all trying to do. But appreciate the dashboard. I think that's been such an important addition. I also wanted to point out that I really appreciate how responsive everybody has been. Ms. Sturgis and I had a conversation about strengthening and enhancing staffing, temporary staffing for 311, for example, as we're seeing such an increase. Also had a conversation with the executive about that. And just in general for my colleagues to know, I, as chair of GO, want to pursue a conversation with our HR director to understand how we approach policies of surge staffing and see if there's anything that the council has to do to facilitate that. This is because we've seen a steady increase in demand for more information, of course. And Dr. Stoddard, you again cited a very important data point regarding our Spanish language speakers. I assume also that the town halls that have been held, where we constantly push out 311 as one point of contact, people are receiving that information and they're using it, which is really wonderful. But some of the wait times have been, extraordinarily long, up to 50 minutes. So we've been working to troubleshoot all of this in real time. And I can't thank enough those in the administration that have stepped up to really solve these issues right away. And then lastly, regarding the food distribution, we also have had those conversations during some of our briefings about a system, right? Because we do have amazing organizations right now working on a lot of points of distribution, food distribution. But as you were saying, Dr. Stoddard, this is going to last a while. Recovery will also demand a lot of this kind of support. So the quicker that we can get to an actual system where people can predict where these distributions are going to take place, the issue of folks who don't have access to transportation, it's a really important point on whatever it is that we're doing in terms of distribution. So I'm eager to hear sooner than later, what kind of systemic approach we're going to take and how we're going to push that out as we begin to think about recovery. But I can't thank both of you enough, again, for your steady leadership and how everybody has taken their own piece and really worked hard to ensure that all of this comes together. It's like a puzzle, but I think that we're moving in the right direction. And I think our public, I gotta say also publicly, I wanna thank our residents for their patience, their trust, and also their sense of taking personal responsibility to adhere to these directives. That has not been the case in other jurisdictions. And we see how this has just created a very, very difficult and challenging situation. But I think in Montgomery County, we can be proud of our residents for really stepping up in this way. And, we'll continue to work on this. So not necessarily questions, because I know you have a lot on your plate, but just wanted to share publicly some of those areas that we have been working on and trying to also put out there. Although perhaps I will just ask Dr. Gales to briefly say something about that, because those are questions we're getting about the issue of whether we're going to be reopening in a week or two, just so that the public understand exactly what it is that we're doing and get that information out there.
Sure. Thank you for your feedback and thank you for your question. And again, want to be clear that, from a health perspective, we're not committing to any date. But, at putting the dashboard out in terms of, when we've said here are metrics that we're going to use to guide within that, we do see a number of favorable indicators that recommend we're moving in the right direction. And it does open up the idea that we could potentially reopen in the near future. From my perspective, it's more of this is informing the process to say we need to be having those conversations about what that looks like. And I think that's, been, at least the general tone of the conversation to say, what does that look like moving forward? How does that compared to other jurisdictions? What types of activities could we potentially safely move forward in doing? And I want to make it clear at home for folks is that we're not going to, whenever that comes, when we reopen in some capacity, that doesn't mean we stop tracking the data and say, we've got 14 days, we're done. We're going to continue to look at that data. We're going to probably bring in more data to refine that, because what we don't want to have happen is, as we open up, get to the point where we see indicators requiring us to go backward. So we're going to be very careful and methodical. Again, we don't want to interfere in people's liberty and their ideas and their ability to do their jobs and function, but we do want to keep them safe, and we're going to be remain committed to that. So I think that basically says we're moving in the right direction. We've seen hope, reason for optimism to be able to make some steps in that direction in the near future. We're not there yet, and we will continue to work with our colleagues in other jurisdictions to figure out how to best move forward.
Thank you very much. Councilmember Jawando.
Thank you, Mr. President, and thank you, Dr. Gales and Dr. Stoddard, as always, for all your work. I always want to start there because I know this is a lot, and it's a very difficult time, and you're doing a lot of things, a lot of balls in the air. So really appreciate the work of you and all the teams and all of our county employees who are helping out. Following up on the line of questioning from Councilmember Navarro to you, Dr. Gales, when I hear and when residents hear things like we're moving in the right direction, soon, in the near future, when we hear those types of comments, and we heard from the county executive in a couple of interviews, specific timelines, and look, I know just as much as anyone, sometimes things come out that you don't want to come out, but that, and so it might not have been intentional. But the point of consistent messaging, we already saw, unfortunately, with what the governor's actions, the way he decided to proceed, that there was a ton of confusion, right? So the day that he announced, and I think I showed this to you last week, I saw 20 or 30 people playing basketball that day. And now I see barbershops opening and salons, and just people are doing things that aren't allowed in Montgomery County, I think in part because of the confusion from the governor, which just underscores the way he handled that situation, which underscores the need for us to be very consistent and clear with our messaging. And so I would ask that, put in a plea that all of us do that. And I know that that's your commitment. And then I would ask, even with the indicators going in the right direction, because we're so low at the amount right now, we're not where we want to be on testing. How can we be sure, and if you could explain to us and to the public, that even these indicators are enough to move into some sort of phase one reopening at some point, despite the fact that we don't have enough testing or widespread availability of testing yet?
Sure. Thank you for the question, and thank you for explaining to folks at home the complexities that go into making these determinations. Based upon some of the emails that I've received, I don't think everybody quite understands it. I think they want things to be open now. But to your question, I think that all of the indicators that we're looking at will help determine, as I mentioned, as we move forward, if we do see positive movement, are there activities or things that could be safely done that would not negatively impact those indicators in a way as they continue to move forward? So, for example, we've looked at, as I mentioned, constant talks with DC and Northern Virginia in terms of, are there some shared activities that could be, considered to be low risk activities that, we would feel comfortable opening that up, wouldn't necessarily be a vector of, great transmission. And so that is going to be the reality, how we move forward. It's going to be a constant reevaluation to say, we're making these steps and making these provisions, as the data continues to improve or move forward in a positive direction, we may be able to increase the activities or functions that are included in that. You're on mute.
I'm sorry, could you just answer specifically the question about testing and how, even without enough testing, how we're able to address that? And then I'm going to ask my other question so I get it in. And so that,
Okay. All right. I'll make it really quick then.
Right.
So in the setting of, again, it's looking at all of the different indicators. So we know that when we increase testing capacity, we're going to capture a number of other cases, particularly those asymptomatic individuals, to arrest them and get them isolated quickly to interrupt their networks of transmission. So we're not just looking at that one sole number, we're looking at the whole spectrum. Because again, if ER visits are dropping, if hospitalizations are dropping, it's suggesting that the severity of it is lessening, at least in this time period.
Perfect. Thank you. And I that's what I thought. I just want to understand. And my last question, my understanding is that we still are not receiving or tracking the county specific data, testing data by race and zip code. Can you talk about that and how we can get there?
Sure.
Particularly as we ramp up testing, I think that's going to be important.
Yeah, so Dr. Liu they're combing back through the previous data to get, and hopefully again going to release as much information as we have to comment on that. And then as I see the hand, but just quickly, one of the things that we're working on and ensuring that when the lab requisition forms are filled out, particularly in the high throughput setting and our alternative test venues, making sure that that box is checked. And so even if we may not have 100%, we can say anything coming from the county sponsored testing opportunities, we'll have that, capture that information.
Thank you. Thank you very much.
Thank you. Councilmember Albornoz.
Thank you, Mr. President, and thank you both for the continued leadership and dedication. Dr. Gales, we've received some feedback regarding the GO teams. You have shared with us the structure that's in place, which I think makes a lot of sense. On the ground, however, we've been hearing concerns about the confusion, lack of response, lack of coordination, and we've especially been hearing concerns within the developmental disability community, sometimes taking a week to get responses back, and real confusion as to, test kits are dropped off, but then confusion as to how to administer them. And so, I know there's been issues with the GO teams in other areas. I know you're familiar with those challenges, and of course, we're setting up something relatively new and putting it together quickly, but could you respond as to what the response of your team will be working with the state on the issues that have been raised and what the plan is? And then I have one more question after that. Go ahead, Dr. Gill.
I'll go really quickly to get your question in. So the first question, with the issue with the state GO teams, so we had a larger conversation. One of the big issues is results reporting. Because the way they were entered in the state database and how they were reported back to us. So we recognize that was a significant challenge. We met with senior officials at the state, representatives from the other jurisdictions who were partnering in that effort to clarify and clear that up. Particularly the agency that we work closely with, I take full responsibility for it. We're working to clean that up. As I mentioned before, I spent one Saturday calling families myself, delivering results. We have a dedicated nurse now on staff who is calling to get all of those results distributed to that one, all of the families who are affiliated with that one entity. Part of it is also a scheduling thing. We, over the last week, colleagues in HHS have partnered with colleagues in public health to come up with a strategy that provides more substantial linkage for families identified, particularly to the social support piece. We are working to strengthen the GO team apparatus by having more teams in place. I think that's part of the biggest issue, is being able to move people around to accommodate the needs. We're going to bring in, our goal is to get at least four new teams to be able to go out and provide that focused, targeted testing on site. And again, hopefully bringing in also less invasive testing measures, such as self-collection kits, would allow for more rapid distribution, as well as simpler collection mechanisms, so that we can spin things around and get them back to people very quickly.
I appreciate that. I'll follow up with you more specifically on this to elaborate a little bit on the plan, but I appreciate your acknowledgement of it, and you're moving towards a strategy. The second question is, we have heard anecdotally from both large private family medical practices and small family medical practices that they're about to go under, bankrupt, because of all of the challenges that they're facing. And so I appreciate that you met with the Medical Society earlier. My understanding is they're conducting a survey literally right now of medical practices across the county. This is very much on the council's radar screen, and we have asked the Office of Legislative Oversight, which I know is working with your office, on giving us as much of an analysis as we can get with the information we have. Is this anecdotal? Is this systemic? And I know we're interested in helping to make sure that we prevent as many of these medical practices from going under as possible, because even before COVID, we know a lot of medical practices were not accepting new patients because they're at capacity. So if too many of them cave at the same time, and us probably having another resurgence in the fall and the spring of COVID and winter of COVID, it's a recipe for disaster. Could you just talk briefly about your conversation with the Medical Society and how that is on your radar screen?
Sure. As a clinician, it's majorly on the radar screen. Particularly, I think you mentioned one of the first facilities that you mentioned was a pediatric office. So that's obviously near and dear to my heart as a pediatrician. So we, as you mentioned, the Medical Society is working on a survey to capture that information. And as I mentioned, we've set up bi-weekly conversations with their members to talk through a lot of those particular issues. One of the other steps I've mentioned before, I didn't go into detail today, but we've created and in the process of creating a public health advisory committee to provide guidance to us in terms of reopening criteria. I've asked the Medical Society to identify a member to sit on that board, so there'll be a dedicated position to represent all of the physicians and clinicians in the county, so that we're taking those types of issues into consideration as we reopen and think about how we can partner to get that messaging out.
Great. Thank you. Mr. President, that was 5 minutes.
Right on target. Right on target. Councilmember Glass.
Thank you, Mr. President. Thank you, gentlemen, for the update. As we were talking, there was breaking news out of the District of Columbia with Mayor Bowser and her team announcing a 4-point plan to reopen once all of the data and metrics lead them into that direction. So I appreciate the questions from my colleagues about what we're doing here towards that. But I just want to take the remaining 4 minutes and 30 seconds to ask you about nursing homes and assisted living facilities. There have been some significant increases in deaths and cases in nursing homes. And for example, there was one that had a 58 case increase in 58 cases from last week. And now that we've been providing more data to the public, it has been shared with me, at least the concern that the increased number of people with COVID-19 here in the county is largely coming from those assisted living facilities and nursing homes. Can you talk about that a little bit, perception versus reality?
Well, as we've talked about before, we're working hard to mitigate those transmissions in the nursing homes, from our local teams, the state teams, and now with the National Guard teams coming in. I know that there was a reference or a request to break down the cases by nursing homes. We're looking at our new cases by nursing homes and non-congregate settings. I do know that some other jurisdictions are doing that in terms of how the numbers are presented. I can have Dr. Liu look into that. I know, for new cases as well as looking at the fatalities, because that, and if looking at it differently may give us reason to say, the new cases being transmitted actually are smaller in a community transmission setting versus a congregate living space.
Right, because as more people are monitoring the situation, especially because the dashboard is now live, they're concerned that the community at large is not able to start the recovery because of the increases, which are largely confined to these facilities. Again, that is a thought that has been shared with me. And so a follow-up question would be then, if we don't break the data down that way, but some are either interpreting it that way or have some other means to delineate it, does that mean that as we continue working within the community to provide PPE or other resources, we need to send more to these facilities so that we can really clamp down on the spread where we know it exists?
Yes. So another piece, I'll get to that in a section, but the first piece I think folks also need to understand is that there has been a significant concerted effort to do universal testing in nursing homes. So it shouldn't surprise folks that a high percentage of the new cases coming up may be in those nursing home settings because we've prioritized getting everybody tested in those spaces. And hopefully very soon we'll be able to prioritize getting the general public so that denominator will increase and it won't look so, that it's so solely on the nursing home. But to your question, certainly it's, when I think of things that keep me up in terms of COVID-19 related things, the nursing homes are one of them and the assisted living facilities. And so, we've got the combination of the different teams going in. As I mentioned, the National Guard teams will have gone into 25 of those homes as of Monday. Our local team is working particularly with those facilities that have had the highest numbers, are in contact on a daily basis with them. We've had additional folks come in and do site visits from the state level. So yes, we are putting out PPE, we're putting out guidance, we're making sure they're doing what they're supposed to do to mitigate any further transmission. Because obviously none of us want to see any situation where we have one case period in a nursing home, but certainly, as you mentioned, we don't want to see an uptick or spike that you referenced in your earlier question.
Okay.
And I'd like to add to that really quickly, because it's such an important point. The people in the nursing home aren't going to Beach Week. They're not catching it outside the facility, so it's being brought in. And it's being brought in because of community transmission coming into the facility. So if we have more community transmission because we open a lot of things up and we're not ready to, obviously we create greater risk for those people who are our most vulnerable. And so I think a lot of the argument that I've seen in certainly the online discourse is, oh, this is a nursing home problem, let the rest of us go frolic freely. But again, the people frolicking freely are driving part of the problem in the nursing home. And so you cannot just disconnect those two things and be so discompassionate. Clearly not suggesting you are, but I just want to make clear that, we have to protect both people, the people living in our nursing homes who are our loved ones, with the general public and the economic impacts that we're causing because of this. And so I think with broader testing and more testing capability, I think we would not move forward without more testing capability. I think that's pretty clear. And we're very close on that. But as we ramp up testing activity, I think Dr. Yels is totally right. You're going to see more cases in the public that are helping to drive what we're seeing because we're looking harder in our nursing homes.
Thank you.
Let me just close by saying, Dr. Stoddard, I appreciate you separating my personal opinion from the questions I'm asking so that the public can better understand. Thank you.
Thank you. And I do think as for the nursing home idea, it's certainly the people living in the nursing homes do not necessarily go out into the public that often, but the people working in the nursing homes do. And so that's something that we always have to keep in mind. Councilmember Friedson.
Thank you, Council President. First of all, thank you to both of you. As has been said, really appreciate all of your work, which has been around the clock, and really appreciate that. I also want to thank the entire executive branch for stepping up with the dashboard as was presented yesterday. There was responsiveness to concerns that council members had, and I think that represents a real step in the right direction. There's still some improvements that I know that you all are working on and that we are pushing for, but it's a real positive development in terms of transparent, accountable, measurable data for residents to understand what we're talking about, why we're making the decisions we're making. And I've been pushing for it, colleagues have been pushing for it, and I think we all appreciate that. I think it was a really positive development, so I want to start with that. Could you explain, because you just hit on it quite a bit in terms of the positive cases in nursing homes partially being a function of the fact that we've increased testing. This is a broader issue, but it raises the question of why positive cases are a data point that we're focusing so much on and making decisions on. Could you explain why we're using positive cases? It hasn't seemed like the governor and the state has used positive cases as part of their data. Could you explain that, please?
Sure. I can't explain what the metrics or what are being used by the governor, but in relation to us, I think it's, again, we're not focusing on one specific indicator. It's the whole concept of the story. And so I think it is important to look at the number of new cases coming up, because that's an early indicator of how is the disease spreading within society. There are some more, sophisticated epidemiologic measures such as your R naught, which is the rate of reproduction of the virus. That's defined as for each person who is positive, what is the turnover, how many people is that person infecting? And so we want to see that number below. So we've tried to create some more simplistic measures for folks to be able to follow and understand while we look at some of those more complex measures behind the scenes. So again, I think looking at the number of new cases is an indicator. It's important because you're looking at how many folks are coming into contact with others. You're getting a sense of how many people you need to be isolated to interrupt those networks of transmission. But we don't look at it in a vacuum. We look at it in the context of, are we doing focused testing? Are we doing targeted testing? Are we doing large scale testing, and not on a specific category of folks? And, in addition to that, looking at it in the context of how many folks we can test, how many folks are in the hospital. So it's a complete picture, not just one measure.
I appreciate that. What is our reproduction number, the R naught number currently?
So currently, actually, Dr. Lou is working on that today. I can get that to you this afternoon. Back in April, we worked with our colleagues at University of Maryland. I think it was in 1.42, but that was in April. Certainly, we'd like to see it be down and somewhere. The goal is to have the R naught below 1. But as I said, he's working on that now. We'll get an estimate to you all this afternoon.
That would be great. And if you could let us know how frequently you're looking at that data to update it, I think that would really be helpful. It does beg the question as we use positive cases of how helpful it really is. If we don't know what it is based off of, what the denominator is as we're ramping up testing, if we're not sharing the testing numbers both in the private and the public sector, then it seems to me that the positive case is not really a terribly helpful data point. So I just think it's something that we have to consider, because we don't really know what is the difference between the new cases and what is as a result of increased infections, or increased number of infected, increased infections or increased testing. It took me a minute to get that out, and you can see how confused I am by this data point because I can't even barely mention it.
With you, I follow you.
Okay, so in terms of the testing capacity, which is one of the criteria that you've set forth, do we have that we're able to share of how close we are to that 50 to 55,000 testing capacity? And is that something that can be shared as part of the daily data that is shared with the public?
Sure. From my understanding, I think there is a list of those qualitative ones. They've got red light, green light, yellow light on there. And so that's updated on a daily basis. And I think, once we can get the ink dries on the contracts with the high throughput option, we will have met the criteria or be very close to the criteria to be able to offer that capacity. And
okay, thank you.
Okay, great. And then just final question. It's clear that not all tests are created equally, that some are quality tests and some are, have false positives and false negatives. Are we looking at the types of tests that we're using and not just the number of tests that we're using?
Yeah, so that goes into, looking through all these different test modalities and mechanisms, is thinking which is the best one. And part of that has been challenging because the FDA has expedited review of a lot of these. Historically, tests will go through a very long validation process. We don't have the luxury of having that, and the validation studies are limited to, to a couple of hundred samples at most. So we're working as best as we can to get as much information as we can to make sure that we're pulling the trigger using the right one.
Thank you. Councilmember Reamer.
I have to go.
Thank you so much. I have to say I'm feeling very dissatisfied. For weeks now, we've been hearing about discussions of expanded testing and new vendors and new sites. And then at each of these meetings, we're almost there. We're always almost there. We're waiting on a contract. We're waiting on something. And this is an emergency. It's a critical public health emergency. So what do we need to do to ensure that the next time we meet, the only response is that these problems are solved?
I share your sense of urgency. All I can say, I know that the contracts team is working to solidify those details. What I can tell you from the health perspective, we have our plans ready to go. We've done our due diligence and meeting with the partners so that we'll be able to roll out our testing strategy, which I've shared with you, as soon as they become available.
Okay, well, a related concern. I heard your comment that the first wave of deployment of testing capacity would be with public safety officers, and I want them to be in the first wave, but I'm concerned that that could mean it would be several more weeks before additional testing is deployed in those specific, really hotspot areas. Why aren't we having a parallel deployment of the first wave of testing through partners in our, for example, Montgomery Cares clinics at the same time as we're deploying our new capacity with our own internal employees?
Sure, that's an excellent question and actually highlights the work we've been doing in terms of creating our buffet of testing options. So as it relates specifically to the high throughput testing opportunity, there is limited capacity as the lab builds up capacity. So those specific samples are focused on that one population. But as you know, we're continuing to continue.
Can I try to understand what you said? So this, can you say that again and just which population did you mean?
Sure. So the population you referenced in terms of our first wave, we have, with that high throughput option, we have X amount of kits. I think we've got 10,000 kits that we have. So for that particular purpose, we're using that for those first line responders to support completing the universal testing in nursing home settings to do that. And so the numbers match up, so we're using that for that. Now, we're continuing to do our other test strategies that we put into place. So the alternative test sites will continue. We're creating, again, working to create the mobile testing arm to support and do the ready responder testing. That will work with our current supply using nasopharyngeal swabs to execute that. We have met our team, our Montgomery Cares team actually met last week with the clinics to do, and they're completing an assessment of their ability to partner in that. I know that there was a meeting earlier this week actually with some community folks to talk about in some of those hotspot areas that you referenced, identifying those and being able to partner to do testing with the county providing some testing apparatus, also having social support services there to link people to, and then bringing on, for example, that particular activity that I'm referencing would involve one of the Montgomery Cares clinics to do some follow-up medical care there. So I think, your suggestion and recommendation of how to continue those partnerships is important. We're working to do that and leveraging those partnerships. But I do want to make sure that just because we have that one testing option that may focus on one particular set of folks in that phase, we're going to continue all of the other testing options that we have in place.
Thank you. Last question. Outdoor is clearly safer than indoor. Are you recommending that we can allow retail on the street, restaurants on the street in phase one? I don't know that was covered in the governor's order, but if we could, can you just talk to us about our ability to differentiate here and allow and have the county begin immediately moving to pave the way for outdoor commerce?
Well, I think, thank you for the suggestion. I think, consistent to the earlier conversation, we're looking at a host of options. We've said, I know the governor has his plan. The governor of Virginia has his plan. We're going to look at, and, with you all's feedback and input, what activities can we do safely that we know will be low risk, particularly as we start to reopen, whenever that happens, that won't cause a significant or put us at risk of having an increase in terms of new cases. And I think that's something that we can consider and look into. I know that some jurisdictions have been doing, curbside retail. And so, that's something else to consider, because again, we want to maximize opportunities for folks at home while maximizing and ensuring they're as safe as possible. So we look forward to that continued conversation.
Thank you.
And I'd like to add just really quickly to that. We're also looking at options like, for example, are there places where we could, when we're ready to do outdoor patio restaurants, can we expand the patio space into potentially the public space by closing roads and other things like that, sidewalks. So we're looking at that as well, and that will be part of our package, because obviously when we're ready to open, we want to synergize the efforts between protecting public health and maximizing the economic opportunity to the restaurants and whomever we're opening for. So we're looking at those things simultaneously.
Thank you. Vice President Hucker. Go
I
ahead,
do actually
please.
have to step out, sir.
Okay, thank you. Vice President Hucker.
Thank you, Mr. President. Thank you both for all your hard work and dedication. It's great news about the dashboard. That's a big step in the right direction. Appreciate the questions from Councilmember Albornoz about the physician practices. I've been in touch with some of those as well. That's going to have big implication for our county and for the state budget as well. So I look forward to more work on that. And great news about the FEMA reimbursements. My colleagues had a lot of good questions. Let me pass on one scenario I heard yesterday from a constituent, because I bet we all have constituents in this boat. Constituent has a daughter who works at a restaurant. The restaurant, her job is packaging up orders and taking them out curbside to delivery drivers and to customers. A coworker of hers tests positive for COVID. And the employer, understandably, doesn't want to identify which worker that is. She knows she's been exposed to that worker in a relatively small restaurant, 10 people or so, for, presumably for multiple days. A, I guess she should go get tested. B, how do we make contact tracing work if the restaurant owner doesn't disclose? Are they compelled to disclose to the government contract tracer who the individual is? And three, given that most of the workers there are being told they have to go to work, they can't self-quarantine, many are undocumented and don't want to go get tested at a government facility and want to just go to work and cross their fingers. Have we ever considered setting up a testing location with one of our nonprofit partners like CASA or Identity at a location that undocumented workers might feel more comfortable going to than a state emissions testing facility or a county government building?
So I know Dr. Gales had to jump, but I think I can actually answer most of your questions. So it's good, right? So yes, I would recommend that woman go and talk to her primary care provider and suggest testing. I think that would be totally appropriate. If she does not have a primary care provider, she can certainly reach out to the disease control line, and they can act as a surrogate for it and get her testing for that specific person. Now, the answer to your other questions about other testing opportunities involving some of our nonprofits, yes. I think actually part of the groups that we're working on planning right now, and I know we've talked to Impact already, for example, is looking at our nonprofits as a delivery mechanism for our test kits, even our high throughput testing kits. And so we're in the process of planning now. I know that there was a number of meetings with Impact and Delegate Charcudian on this very issue in the Long Branch area to talk about, and this would be applied across the county as well, about giving endpoint service delivering nonprofits access to our kits, have them collect the samples because they have the relationships that are already built on the ground, and then bring them back to us, and we'll have the high throughput testing vendor run the tests. And so I would expect actually that, that will scale up just as everything else scales up, but I would actually expect that we'll be utilizing some of our early high throughput collection kits, including potentially the first week high throughput collection kits, in some number to do some of those things as well. And that will expand in weeks thereafter as we have access to more testing.
Sorry, how soon do you think? That's great news. How soon do you think you could stand that up?
So, I've been promising that we've been signing this contract and the lawyers have been involved, and they are, looking after the company and the county's best interest. And, it's frustrating for us too. I think we could talk about it. I know that I've got another letter coming to you all, I think to, Councilmember Reamer had sent a request for some additional planning, and I think you'll see that would be reflected in our second round of testing. So the first round would be get the test kits. Let's I won't talk about that, but let's just say that we signed the contract today. We get 10,000 kits tomorrow. The first round we've talked about, I think, through the nursing homes, correctional facilities, and our first responders. The second round of kits next week, we would not have to repeat all of those pools that we've already tested. We'd expand it out to include some of our mobile testing arms, but also I think we've talked, and I think I know specifically that Public Health has talked to a number of nonprofits about taking some number of those kits immediately and start doing community-based testing.
Great. Terrific. Thanks. That's it for me. Thank you, Mr. President.
Thank you. Councilmember Navarro asked for another round, please.
Yes, I'll be brief, following up on that last actual question. As the announcement has been made by the state utilizing CVS as another other sites to provide testing, the ones that have been assigned for Montgomery County, none of those zip codes actually are aligned with the zip codes that we've been tracking as the high case zip codes. So they've identified 20814, 20852, and 20870 as sites for Montgomery County. So as we move hopefully expeditiously to get through the high throughput testing, I would urge us to ensure that we are focusing on the 20902, 20904, 20906, because obviously we need to ensure that we're present in those particular zip codes. It's disappointing that the state would choose as priorities only these particular zip codes, because obviously we're trying to get as much capacity as we can. But I think aligned with everything that we've said, let's make sure that we're targeting then whatever extra capacity for testing we could find. Thank you.
Thank you. Thank you, Dr. Stoddard, for being with us today. And Dr. Gales, we will tell him the next time we see him, thank him for being here. We sincerely appreciate the updates.